It started out when I was born. My mother's father is a dentist, and two of her sisters, I think, are dental assistants. So my first memories of going to the dentist are kind of weird. Because you're a kid, you love your grandfather, but you're terrified that he's going to do something to your face. And so I have a lot of really mixed feelings on the dentist from my childhood. So after I moved up to college, I didn't want to go back to my grandfather for dentist work. And I didn't look for a dentist as a young adult and was like, oh, it'll just take care of itself. My teeth felt gross, I had really bad breath, they were starting to crack. I got the whole thing done. They did x-rays, they took pictures, they were like, okay, Jenny, this is what you need to have done. And I read the list and I panicked. I absolutely panicked. I had the mistake of looking at the bottom line, the whole number, and I was so ashamed. I knew my grandfather would be disappointed in me, my mom would be disappointed in me. This is what I thought. And I panicked and I never went back. I got married and my husband's like, you have to do something about your teeth. And I'm like, I'm scared. He said, well, don't be scared. You go to these people because they're professionals. You go to these people because they're the best at what they do. You have to trust them to take care of you. I'm like, wow, that makes a lot of sense. So I came back and they did the whole workup again. And this time I sat down with Miss Kathy and she's like, don't look at the bottom number. Think about it in little bites. Think about it in pieces that you can understand and that we can talk through and work through. And these are the tools she gave me to help ease my fears and to help me say, okay, this is something I can do. So I had a couple of root canals, I had a couple of fillings, I had some teeth pulled, I had some crowns done. I still have a little bit more work to do, gonna get a bridge in there probably at some point. I go to sleep and I usually wake up a bunch of times during the night because I am very high fear. This is a very stressful thing for me. And I take my pill right when you're supposed to, 6 a.m. Because that I can take this pill beforehand and it helps ease some of my anxieties. I don't want to say it's fun because you're going to the dentist and that's not fun, but it's encouraging, it's happy, it's not, oh, this super ominous thing. No, I look forward to saying hi to everybody and they remember me and they laugh with me. Okay. And then, they take you back and they sit you down and you're like, oh, this is super real. And the lady who helps prep you is super, super nice. Anyway, so you sit down in a chair and you're like, oh, so scary. And then you don't remember anything. And it is the best. So I just lay back and I go to sleep. And then a few hours later, I'm on my couch and I don't know how I got there, and that's okay. And my husband tells me all the silly things that I've said while I have been out of it. So recovery from it is way better than I remember as a kid. And recovery from this stuff hasn't been as bad. You're groggy from being under for a while, and maybe I'll take Percocet for a day, but after that, I can start eating again really quickly. It's so warm. I think the main difference is I come in and I'm not a chart. I'm a person. I feel so good. I'm so scared of going to the dentist. I get worried, but remembering that I'm coming into a place where people care about me, that makes me feel better. It makes me more likely to actually come in. And takes the time to say, hey, what do you want done with your teeth? What's the outcome you want, and how can we get there most efficiently? Dr. Dan is just like you think somebody named Dr. Dan would be. He is bubbly, he's exciting, he's nice, he's kind, and he's so good at his job. Everyone who's seen my teeth has been like, wow, those look perfect.
Great.
I love working with him. So, it's really improved the quality of my life in a lot of ways. First off, there's just the pure physicalness. Because I had some broken teeth on this side, and I wouldn't chew on that side because teeth are kind of screwed up, didn't have anything to chew with. So now I take a bite of an apple, have not bitten an apple like that in years, and I'll chew it on both sides, and it tastes better. I can taste more, I get more juices from the different foods I eat. It's so wonderful. So there's the pure physical aspect. I don't have broken teeth, I can eat more things. And I'm more confident. I know when I smile, people are looking at me and they're seeing me as a person. I don't feel like they're seeing me as broken teeth. I feel like that's what everybody saw before, is they just saw this mass of broken teeth. And I felt, even though maybe it's not accurate, I felt maybe they judged me as a person on that. So I feel prettier. I laugh more, I smile more. I'm so much more confident. I feel like having this huge fear and being able to start working through it has given me the confidence in other areas of my life. I did a Spartan race on Saturday. A Spartan! Those are crazy obstacle races, and I feel like, I honestly feel like if I hadn't gotten my teeth done, I wouldn't do that. It's so much more confident.